As Omicron is detected in more places here in the U.S., governors are once again being faced with the challenge of defending their states from the spread. Colorado is just emerging from a surge from Delta, but identified 2 cases of Omicron this week, both connected to recent travel in southern Africa. Colorado Governor Polis joins us now. Good morning, Governor. First, I want to ask you how your infected Coloradans are doing this morning.
Good morning, Martha. So far, everybody's fine. We only have 2 or 3 cases here, and no different than other cases. They are immunized. They have been immunized, and they're doing fine from a health perspective so far. Thank you for checking.
And I know you have said you're not terribly alarmed about Omicron yet. On what do you base that?
So, you know, one thing about this virus from the very start, Martha, we always wish that we had next week's information this week, next month's information this month, but we don't. I think what we're all looking for at this point is what characteristics the Omicron variant has that are different. We know it's a different mutation of the virus, but how does it spread? Does it spread more? Does it spread the same? How do our immunization hold up? How does natural immunization from prior infection hold up? How do the vaccinations hold up? And then finally, how virulent is it? Is it just as virulent? Is it less virulent? Is it more virulent? We simply don't have answers on these questions today, but I expect that we will in the next few weeks.
And I know, Governor, no one wants to panic, but there are experts, including those from Moderna, who look at the variant and say, this is not going to be good. And early research shows it's more transmissible.
It's clearly a very different variant. It's different than the whole branch of the viral family that led to the Delta variant. And as you indicated in your introduction, we're just recovering from a wave of that. There's some states that are going up. Ours is going down, has been for a week or 2, but we're just recovering from the Delta variant. So again, we want to see how well the vaccinations hold up. As far as the data that we have to date shows, the most effective way to prevent Omicron or any variant is simply to get vaccinated and then to get boosted 6 months later. And we're encouraging all Coloradans to do that. And because of our higher than average vaccination rate here in Colorado, our Delta wave didn't peak at the same level of hospitalizations that it did in some of the states that had lower vaccination rates.
Your vaccination rate in Colorado is about 72% for just the first shot, yet hospitalization rates there remain very high. 95% of ICU beds are occupied, and about half of the facilities are anticipating staff shortages within the next week, according to your own Department of Public Health. Are you confident hospitals can handle that, even with a slight uptick? And I think your total vaccination rate is only about 64%.
So, yeah, we're grateful that 5 to 11-year-olds can now be vaccinated. We're eighth in the nation so far. About 22% of our 5 to 11-year-olds have been vaccinated. Just to put some real significance behind that statistic you just cited about hospitalizations, we have 1,368 people hospitalized with COVID in Colorado. Over 1,130 are unvaccinated. So we just have slightly over 200 vaccinated Coloradans hospitalized. That's from that 20 to 30% of people. And then we have the 1,100 people that are unvaccinated. I'm sorry, that's from the 20 to 30% of people that are unvaccinated, just to show the tremendous efficacy of the vaccine in keeping people out of the hospital. One more point on that. While we're at about 93, 94% of our hospital capacity, only about 15 to 20% of that is COVID. The rest is everything else under the sun: heart attack, cancer, other routine issues, some of which had been postponed during the pandemic to the detriment of people's health.
But with the Omicron coming, that could get worse, and you'd have to put off some of those surgeries.
Yeah, there's no question that people across the country who have what you might call elective surgeries that are still important for people's health, back surgeries, knee surgeries, oftentimes when there's a peak have had to delay those surgeries a period of weeks or a period of months. They've certainly continued at a slower than normal pace here in Colorado, even during the height of the peak. But certainly when our hospitals are full with not just COVID, but other conditions from people that had been putting off treatment during the pandemic, there's a bit of a catch-up period. I think that's part of what we're experiencing here in Colorado and nationally right now. The last thing that we want is another wave. Now, again, I think what we're all waiting to see is how virulent the Omicron variant is, how effectively it can break through prior immunization, and how contagious it is. And those three factors will really determine the spread of the virus. It is not yet at a level of community transmission in Colorado that we're picking it up. We have a few isolated cases, but we do regular wastewater screening. It has not come up in that. And we also screen about 15 to 20% of our tests. And we do tens of thousands of tests per day for the indicators of the Omicron variant, and none of those have come back with that Omicron variant yet. So if it had a high level of community transmission, we would know it. It hasn't occurred yet.
Thanks very much, Governor.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.